Hello, how are you doing? This is Dr. Tinuade again. So today we're going to talk about an important topic called Granuloma inguinale. It's a sexually transmitted disease. But before then, have you followed me on my page on Facebook? If not, please do so. Dr. Tinuade is here again, and the name of my page on Facebook is STI and Female Matters with Dr. Tinuade. On Instagram, Ajani Tinuade. On YouTube, Dr. Tinuade on STI. So today let's talk about Granuloma inguinale. It's a sexually transmitted disease. It's one of the causes of genital ulcer. We have other bacteria that can cause genital ulcer, other viruses, but this one we're talking about today is Granuloma inguinale. And we are talking about it because we see them around us. It's commoner in the tropics, subtropics, so it's something we should talk about. Though in some other parts of the country, they say, oh, the incidence is reducing. But because we still have it, even if it is reduced in other parts of the country, we are still going to talk about it. So Granuloma inguinale, and it's caused by a bacteria. The name of that bacteria is called Klebsiella granulomatis. So what happens when people get infected by sexual intercourse? Although people have talked about other means of transmission, but those other means, they are not common, they are rare. It's possible for somebody to auto-inoculate himself or herself or another person. What I'm saying is because it causes ulcer, wound. So somebody can touch the wound, use that hand to touch another person, the person can get infected, or use that hand to touch another part of his or her own body too, and that area too can get infected. A mother too can pass the bacteria to the child, as in a mother can infect her baby when the baby is passing through the birth canal. So then the incubation period, that means from the time of infection till the time that we have the manifestation of the bacteria, can be a day, it can be a year, and it can be 50 years. And it's a chronic infection. That means it can be there for a long time, for years. It will just be progressing to different stages. And how does it happen? It first starts like a nodule, something like a pimples, a growth on a body. And that area is painless and it can be itchy. So by the time you start scratching and scratching, it will form an ulcer. And this ulcer, it bleeds on touch. If you touch the ulcer, it will bleed. It has like a raised head and it's beefy red in color. When we say beefy red, have you seen beef before? Beef, cow meat, it's red. It has its own color. That's how Granuloma inguinale, that's how the ulcer forms. That's how it looks, beefy red. And this ulcer too can now progress because the bacteria is still there working. So we can now have the bacteria affecting the lymphatics, affecting some things we call lymphatics, because I'm talking to the public now. So what do we now have? We can have swelling, elephantiasis of the leg and of the scrotal area. That place can get swollen, and it can now progress again to form cancer. And the name of that cancer, we call it squamous cell carcinoma. So that's the progression of Granuloma inguinale: nodules, ulcer, elephantiasis, cancer. And that's why we said it's a chronic thing. It just continue and becoming, the lesion is getting bigger, is getting bad, and like that. So that is how our Granuloma inguinale is. And that ulcer, we can see it on the head of the penis, and it can cause what we call auto amputation. Of course, that's not the only bacteria that can cause auto amputation. We have other bacteria that can cause auto amputation, but Klebsiella granulomatis is one of them that can cause auto amputation. So that means it can chop up the head of the penis. That's what it means. It can cut it off. That's all this amputation that we are talking about. And also you can see it around the anus because of anal sex. And in women, you can see it in the labia minora, that inner side that is housing the vaginal orifice. You can see it in that place. You can find it in the cervix, upper part. That's the lower part of the uterus that you can't see easily with the eyes unless maybe you use couscous and some other thing. It can be there. You can find this ulcer around this place, and it can infect both male and female. Though the elephantiasis is said is commoner in female, but both male and female can get their private part swollen. Even their legs can be swollen. So what we are trying to say is granuloma inguinale is around us, is sexually transmitted. If you have it, come for treatment. Don't leave it till the thing now become cancerous. We have drugs that we can use for the treatment, and the wound too can be treated. There are other complications that can arise from the wound, but I'm not going to talk about that. What I've spoken about granuloma inguinale is enough for us to understand that it's sexually transmitted, is a chronic infection, that it has a progression, and I've described how it looks. So if you have any question, you can contact me on my Gmail, which is Dr. Tinuade, talking about STI 023@gmail.com. I will say that again, Dr. Tinuade, talking about STI 023@gmail.com. And you can contact me on my business line, actually, 0811774239. I will call that again, 0811774239. So if you have any question, clarifications, you can contact me. Till another time, bye.